Imagine a world where a single disease could wipe out entire families, where survival depended on luck, not medicine. Then one simple experiment changed everything and saved millions of lives. A world before vaccines. Before the invention of vaccines, infectious diseases were among the deadliest threats to humanity. One of the most feared diseases was smallpox. It spread rapidly from person to person, causing fever, painful skin eruptions, and often death. Those who survived were frequently left with permanent scars, blindness, or other complications. Entire communities lived in fear of outbreaks. Smallpox did not discriminate. It affected rich and poor, young and old. Epidemics could wipe out large portions of populations, and there was no reliable cure. People tried various methods to protect themselves. One early practice, known as variolation, involved exposing a person to material from smallpox sores in hopes of creating a mild infection and immunity. While variolation sometimes worked, it was risky. Some people developed severe illness and died. The world desperately needed a safer solution. The observation that changed everything. In the late 18th century, an English physician named Edward Jenner made a remarkable observation. Jenner noticed that milkmaids, women who worked closely with cows, often contracted a mild disease called cowpox. Cowpox caused minor symptoms in humans and was not usually dangerous. But here was the interesting part. Milkmaids who had previously been infected with cowpox rarely caught smallpox. This observation led Jenner to ask an important question. Could exposure to a harmless disease protect people from a deadly one? At the time, this idea was revolutionary. The first vaccination experiment. In 1796, Edward Jenner decided to test his theory. He took material from a cowpox sore on a milkmaid's hand and introduced it into the arm of a young boy. The boy developed mild symptoms but recovered quickly. Later, Jenner exposed the boy to smallpox. Remarkably, the boy did not become ill. Jenner had demonstrated that exposure to cowpox could provide protection against smallpox. This was the first successful vaccination. The word vaccine itself comes from the Latin word vacca, meaning cow, a reference to cowpox. A new medical revolution. Jenner's discovery marked the beginning of a new era in medicine. Unlike previous methods, vaccination was much safer than variolation. It did not involve exposure to the deadly smallpox virus itself. However, acceptance was not immediate. Some people were skeptical. Others feared the procedure. There were even strange rumors and misconceptions about vaccination. Despite resistance, evidence continued to grow. Vaccinated individuals were far less likely to contract smallpox. Gradually, vaccination began to spread across Europe and beyond. Governments and physicians recognized its potential to prevent disease on a large scale. The spread of vaccination worldwide. Throughout the 19th century, vaccination programs expanded. Countries began implementing organized efforts to vaccinate populations against smallpox. Public health systems started to develop around the idea of prevention rather than just treatment. Vaccination campaigns reached different parts of the world, saving countless lives. Over time, improvements in medical science made vaccines safer, more effective, and easier to distribute. Jenner's idea had grown into a global movement. The science behind vaccines. Vaccination works by training the body's immune system. When a vaccine introduces a weakened or inactive form of a pathogen, or even just a part of it, the immune system learns to recognize it. The body produces antibodies and prepares defenses. Later, if the real disease enters the body, the immune system can respond quickly and effectively. This prevents illness or reduces its severity. Vaccines essentially teach the body to fight diseases before they can cause harm. This concept became one of the most important foundations of modern medicine. The eradication of smallpox. One of the greatest achievements in medical history was the global eradication of smallpox. In the 20th century, international health organizations launched widespread vaccination campaigns. Millions of people were vaccinated across continents. In 1980, the World Health Organization officially declared smallpox eradicated. It became the first disease in human history to be completely eliminated. This success demonstrated the power of vaccination on a global scale. It showed that coordinated efforts and scientific knowledge could overcome even the most deadly diseases. Beyond smallpox, expanding protection. Jenner's discovery did not stop with smallpox. It opened the door to the development of vaccines for many other diseases. Over time, scientists created vaccines for illnesses such as measles, polio, tetanus, influenza. These vaccines have saved millions of lives and prevented countless illnesses. For example, polio once caused paralysis in thousands of children every year. Vaccination programs have reduced cases dramatically worldwide. Vaccines have become a routine part of healthcare, especially in childhood immunization programs. Challenges and misconceptions. Despite their success, vaccines have sometimes faced opposition. Misinformation, fear, and lack of understanding have led some people to question their safety or necessity. However, scientific evidence consistently shows that vaccines are one of the safest and most effective tools in medicine. They undergo rigorous testing and monitoring before being approved. While no medical intervention is completely without risk, the benefits of vaccination far outweigh the potential risks. Public education and trust remain essential for successful vaccination programs. The lasting impact. The invention of vaccination has transformed human history. Before vaccines, infectious diseases were a leading cause of death. Today, many of those diseases are preventable. Vaccination has increased life expectancy, reduced child mortality, prevented global epidemics, strengthened public health systems. It has allowed societies to grow and thrive without constant fear of deadly outbreaks. From a simple observation about milkmaids to a global medical revolution, vaccination stands as one of humanity's greatest achievements. The legacy of Edward Jenner. Edward Jenner is often called the father of immunology. His work laid the foundation for modern vaccine science. What makes his story remarkable is its simplicity. He did not have advanced technology or modern laboratories. He had curiosity, observation, and the courage to test an idea. His discovery continues to save lives even today. Every vaccine administered carries forward his legacy. From a small experiment in 1796 to a global shield against deadly diseases, vaccination changed the course of human history. It turned fear into prevention and survival into certainty.